women with atrial fibrillation have a higher risk of thromboembolism compared to men. In contemporary practice, do rates of anticoagulation use vary by gender? And has this changed over time with the introduction of the NOACs? Those are a couple of questions. We have some answers from the gender differences in use of anticoagulants for atrial fibrillation. It is a report from the NCDR, and I'd like to introduce you to Lauren E. Thompson, MD, a cardiology fellow at the University of Colorado at Denver and the Health Sciences Center there. So why did you decide to go to the National Cardiovascular Data Registry and look at this particular issue?
Yeah. So we've known for a really long time that there have been gender differences in many realms of medicine, particularly in cardiology. The NCDR and Pinnacle Data Registry, for one, has a great opportunity. It covers many practices across the United States, covers a broad spectrum of different patient populations. And so we thought it was an ideal source to kind of answer this big picture question. There's also recently been some studies suggested from Europe that showed that maybe these gender differences didn't persist. So we wanted to ask that question in our contemporary practice, particularly given that there's been significant changes with NOACs coming into the treatment options for AFib, as well as the fact that women also have the opportunity to get experienced and exposed to different cardiology practices. We have the CHADS-2 VAS score, which looks at female gender, whereas before we used to use the CHADS-2 score, which didn't incorporate that in. So we thought between the CHADS-2 VAS score coming into practice and the NOACs, maybe these gender differences that had been seen in the past no longer persisted.
And this is one of those areas where big data can really help answer some questions, and some important ones. So what did you do and what did you find?
So we essentially looked within the Pinnacle registry, and so we looked at all people who had an indication for atrial fibrillation, so those who had a CHADS-2 VAS score greater than 2, and we looked to say, does gender predict whether patients will get an anticoagulant prescribed when it's indicated? And essentially what we found was that women were less likely across all levels of thromboembolic risk to have an anticoagulant prescribed, and so anticoagulants could have been warfarin or NOACs.
I believe somebody, probably me, said that they tend to have a higher risk of thromboembolism compared to men.
That is true. And that is why in our CHADS-2 VAS score, it's incorporated as an independent risk factor. Female gender alone is a risk factor for thromboembolic events.
So now what do we do, now that we know this?
I think we have to ask some questions why. There's a couple of things that go into it, whether it's concern that us as providers under-recognize female gender as a potential risk factor. That's certainly one option. Is there a difference in patient providers? Are women less likely to want to be on an anticoagulant compared to men? We don't have that question answered. I think there's also the potential that there's unintentional bias that comes in based on gender alone. And so I think we just need further work looking into that.
Are you willing to do that?
Oh, I hope so, yeah.
I mean, it's an important topic, and I was just kind of surprised when I saw the data. It's like, oh, nuts.
Yeah, I think there's a couple of things. You know, the overall use was low in women and men, I think suggesting that there's room for improvement in our anticoagulation prescription patterns for both women and men. But regardless of that, it's significantly lower in women. And so I think just raising awareness that this might potentially be a bias that we're not aware of is certainly important. You know, there's been other studies that have shown that women have a risk treatment paradox, and I think this just kind of goes again, so women with higher risk being less likely to get the interventions or medications that are indicated.
Well, when you do that study, can you come back and tell us about it? Because this is an important topic. And here at AHA in Orlando, there are 19 abstracts highlighting data from 5 NCDR hospital-based registries and then the outpatient Pinnacle registry, as we're talking about. Please check online and in CardioSource World News and CardioSource World News Interventions for highlights from this meeting, including the NCDR. And for both publications, I'm Rick McGuire, the Executive Editor.